A little bit about the concept of breast cancer recurrence and the treatment strategy in its various forms. Most women who have undergone treatment for breast cancer do not experience a recurrence. After successful treatment of the primary cancer, the patient is considered to be in remission. However, women with breast cancer need to closely monitor their condition, as the disease can return months or even years later. This is called recurrent breast cancer and can occur in the breast itself after a lumpectomy, in the chest area after a mastectomy, local recurrence, in the lymph nodes under the arm, regional recurrence, or in other parts of the body, systemic recurrence or metastasis. The likelihood of recurrence depends on several factors, including the type of cancer hormone receptors, the stage and age at diagnosis, as well as genetic makeup. There are many reasons why this might happen, but recurrent cancer develops from the primary breast cancer and usually has similar characteristics, although there may be some differences. Returning to the treatment strategy for breast cancer, surgical treatment of breast cancer may involve the complete removal of the breast, mastectomy, or the removal of just the tumor, lumpectomy, leaving the rest of the breast intact. After a lumpectomy, radiation therapy is usually administered to the remaining breast tissue to reduce the risk of the cancer returning to the breast. Numerous studies have shown that lumpectomy with radiation has the same survival rate as mastectomy for breast cancer. However, surgical treatment only removes tumors in the breast and does not eliminate cells that may be outside the breast, so patients are usually recommended systemic treatment after both types of surgery to address cells in other parts of the body. Systemic treatment includes the use of medications that circulate throughout the body and reduce the risk of cancer spreading beyond the breast. It may include taking anti-estrogen pills, intravenous chemotherapy, or immunotherapy. Systemic treatment is often recommended after both types of surgery because modern technology cannot detect all cancer cells in the body, and it is assumed that some may be outside the breast even in early-stage breast cancer. Medical oncologists help patients make these decisions. Types of breast cancer recurrence and general treatment strategy. There are several types of breast cancer recurrence, each with its own characteristics and requiring different treatments. Local recurrence occurs when cancer returns to the same area where it first appeared. This is rare, occurring in about 5% of cases, and is more commonly observed in younger patients or with aggressive types of cancer. To reduce the risk of local recurrence, it is important that the cancer is completely removed after surgery, clear margins, and additional radiation may be recommended. Regional recurrence occurs when cancer is found in the lymph nodes in the axillary or clavicular area. Lymph nodes play an important role in the immune system, cleansing tissues of waste and toxins. In cancer, cells can be captured, leading to pain and swelling. Treatment for regional recurrence typically involves surgical removal of the affected nodes and may require radiation therapy and systemic treatment. Systemic recurrence, metastatic breast cancer, is characterized by the spread of cancer beyond the breast and regional nodes to other parts of the body. This occurs when cancer cells move through the lymphatic system or bloodstream. Metastatic breast cancer is considered incurable, but it can be controlled for a long time. The most common sites of metastasis are the bones, less commonly the lungs, brain, and liver. Early systemic treatment is the most effective way to prevent breast cancer metastasis. Cancer of the other breast is not a recurrence but is a concern for most women. The risk of a second cancer depends on the presence of a genetic mutation that caused the first cancer, as well as the age at which it developed. BRCA mutation carriers have a higher risk of developing cancer in the opposite breast. For most women, the risk is about 0.3 to 0.5% per year or 3 to 5% over 10 years. The use of anti-estrogen drugs can reduce this risk. It is important to discuss with your doctor ways to reduce the risk of recurrence or opposite breast cancer. It should be remembered that the risks are probably lower than we think, but it is still necessary to undergo the recommended treatment, including radiation therapy after surgery and systemic treatment.